Hello parents, this video is mainly regarding the recent advances in autism testing or treatment. So far we have known that although lots of research is going on, there is no particular single medication that can be told as a cure for autism. Of course, there are some FDA approved medications like risperidone, aripiprazole, but they are mainly for the symptomatic control. Like if there is a aggressive behavior, excessive restlessness, high amount of stimming, repetitive behaviors, that can be reduced with the medication. But there is nothing very specific which can be told as a cure to autism. Lot of research is going on, and we are hopeful that in future we'll find a cure. But as of now, there is a small ray of hope that is in the form of the kids with autism showing some amount of good improvement with folinic acid supplementation. But before I go into the details, let me tell you that this is still under research, and it is not like a cure for autism, but definitely they are seeing good improvements in children, especially in their speech and language domain, which is the main concern of many of the parents. So now, will it work for all? Definitely not. There is a subset of autism cases in which this folinic acid might be very useful. Now, how do we know which kid will respond, which may not respond? So, is there any specific test? Yes, again, this is in research. It is not widely available across the labs, but and in the research, there is something called folate receptor antibody testing, which is called FRAT. So, are there any good studies on this? Since 2005 almost, people are using this antibody testing, but for only their study purpose or for research. And there are four large studies which were published also, 2005, 2017, and then 2024 one from India also. AIMS Rishikesh, Uttarakhand has the pediatric neurology department has taken around 40 plus kids and divided it into 40 of placebo control group and 40 of group in which intervention was given, and they tested them with this specific antibody testing, and almost 70 to 80% of the kids did test positive for these antibodies, and around 20% did not test positive, but they gave folinic acid supplementation to the entire 40 kids, and in another 40 kids they haven't given any folic acid supplementation. Both of them have continued with their behavior therapy, speech therapy, OTs and other things. And then in a period of 24 weeks, that is around 6 months, what changes did they notice? The ones in which folinic acid was supplemented had a better outcome in the way that their car scoring came down by almost 4 points, their language speech has improved, in few cases significantly, in few cases to a limited extent, but definitely improvements were there. So this is some positive ray of hope is definitely there. Now, is this testing widely available? So as of now, like I said, it is still under research. So recently we did ask two main labs, one in Hyderabad and one in Vijayawada, can we get these tests and start doing in India, because they have to be imported from abroad. So they obliged to our request, and now they have started this. We have just started in July ending or almost from August. So we are sending samples from our center Bhimavaram also, and there are some positive reports in that, and those children are showing good changes with folinic acid supplementation. So we are now planning to extend this testing to the kids whom come for consultation in Hyderabad or our Hyderabad center kids. So the details of all these studies I'll be leaving below, so that the parents can themselves see what exactly are these studies, etc. But in this video I would just like to tell you the basic mechanism in which this folinic acid works. So basically it is a reduced form of folic acid or folate, which we know as, we have lot of vitamins in the body, A, D, K and B vitamins. In the B again we have B1, B2, B12, B6, B7, B9, etc. This folate is B9 vitamin. It is very important vitamin for specifically the gastrointestinal tract, blood and brain. So here we are mainly interested in the cerebral folate metabolism and its effect. So this folate after we take the food, the folate is after it is entering into the blood from the digestive system, this folate should be carried to the brain, inside the brain, and there is some barrier between the blood and the brain, that is called the blood brain barrier. And only those forms of folate which are in a reduced form can bypass the, they can cross the blood brain barrier easily. For the rest of the folate, they have to go through a receptor channel. You can just imagine it like a gateway. There is something like a check post, and the activated form of folate has to pass through the check post. If for some reason this check post is blocked, that is what we mean by these antibodies are present which are blocking this check post, there is no way that this folate can enter into the brain. In these cases, this folinic acid, this doesn't require the crossing the check post. It can go through a back door. The mechanism is little medical difficult to understand, but by different mechanisms it can enter into the blood bypassing the check post. So even if antibodies are present, and especially in those cases in which antibodies are present, this is a good way of bypassing that and entering into the brain. And once it enters into the brain, it enters into the intracellular compartment, and then it becomes into furthermore activated form, and from there its action starts. It is very important for your DNA RNA synthesis. It is important for synapse regeneration or synaptic plasticity. It is also important for myelination, that means the sheath that is covering the neurons and axons, etc. And it's also very important for production of lot of neurotransmitters like the dopamine, the serotonin in the brain. The final pathways require this activated form of folate. So I hope you have understood in a brief way what is the action. So these kids in whom these blocking antibodies are there, they are the ones who are going to probably respond much better. So if the question is what if the report is negative, can we still try? We can still try, but the chances that it is going to work are less compared to the chances that it is going to work in that subset of population in whom antibody titer is high. So now this test is available here, like I said, so you can get in touch with us if you are interested in getting this test. This test we are doing as a combination of at antibody levels as well as some of these metabolites which are like an indirect evidence that folate is deficient in the brain, which are like homocysteine levels, your levels of creatine, and then guanidoacetate. They are certain markers. Based on these markers, we can also say that even though antibody titer is low, if these markers show some deficiency or increase or decrease according to the report, we can still go ahead and try folinic acid in these kids. So get in touch with us if you are interested in getting this test. It is a simple test. One blood prick and 5 ml of sample will be collected, and the report will be maximum dispatched by 5 to 7 days to you. And then we can discuss about the dosing protocols, etc. Hope it's clarified many of your doubts, and I'm attaching a lot of articles below for your reference. And once more, I want to say that this is not a cure for autism, but definitely there is some hope that this may be the next future treatment for many of the autistic kids. This video is mainly for parental awareness that some recent advances in autism are there, especially in what subset of kids this might be useful, and they should not be used like an over-the-counter purchase of the drugs and using these drugs, because every drug comes with a side effect, and you have to discuss the pros and cons and only proceed with expert advice. Thank you.